I'm Jared Weiss. I focus on lung cancers and head and neck cancers. I chose these specialties very intuitively. In training, I met my first lung cancer patients and head and neck cancer patients, and I had the same intuitive feeling that I later had, minus the romantic component, when I met my wife. The feeling, these are my people, these are who I want to serve. And since it's been a great joy to do so. These are populations who are heavily stigmatized, that many other doctors, let's say, don't derive as much joy in treating, and I consider an honor and privilege to do so. Optimal care is the intersection of several axes. The most important of these are patient values. The patient has to inform the doctor what he or she cares about, and then we need to be servants to that. But then how to optimally serve that vision, that goal from the patient, other factors come into play, such as the performance status of the patient, how much energy they have, their other medical problems and how those would intersect with the cancer or with its treatment, the stage of the cancer, the biology of the cancer. At UNC, we believe strongly in comprehensive molecular testing and PD-L1 testing, which is a marker for immunotherapy. And putting these together is complicated. It requires a collaboration between the patient, his or her physician, their nurse navigator, disease-specific pharmacists, surgeons, radiation oncologists. And I think that's what we do best here. We put together these complex axes to provide optimal recommendations that fit a patient's values. We put together the resources of a very big place with cutting-edge technologies, and we use those as the tool to drill down to what an individual person cares about. The first and really only purpose of our research is to advance care for our patients. More specifically, we seek to improve quality of life, and we seek to improve duration of life. And so all of our laboratory and translational work is focused towards making trials for better therapies. And when we select which trials we are going to open and run, they are aimed squarely and only at what we believe is most likely to help the patients who enroll upon them. It's not just about the care that I provide, it's about the dynamic of the interaction. It's critical to me that we have an alliance, that we're a team. The patient, myself, the people who love them, and all this other supportive care services here, and that we're all working towards the same goal. And that perspective, I think, creates the mutual trust where I can translate the newest scientific findings and opportunities and work together with the patient into how that fits with their values.